just like a warning on this video, if you are not good, I'm not going to show any pictures of like blood, but the recovery is very bloody. So if you don't like hearing that word, or you don't want to hear about all of that and all the details, then I would probably suggest clicking off of this video. I'm going to be telling you why I had sinus surgery and a septoplasty. That congestion and postnasal drip never stopped. My septum was deviated and my sinuses were all like completely congested. So I was crying blood. A week post-op, I had my appointment. She used this tube that was a vacuum to clean out my sinuses. I also wore the gauze mustache on the way home because she said I could bleed after, which I did. I'll get into that in a moment, but when I got home I could actually breathe through my nose a little bit, and I was like spitting blood every half hour because I didn't want to swallow it, and I tried to sleep, but I choked on the blood because it was going down my throat, and my throat just was really clogged up with the blood. On day 9, I wrote down the time too, at 5:40 p.m. a large drop of blood fell from my nose, and I thought that I had a really bad nosebleed. I remember like I walked into the bathroom and I could feel like a drip coming out my nose, so I tried to get a tissue, and then it just went boop, and there was like a drop of blood on the ground. I was like, okay, let me get some tissues, but the bleeding would not stop. I've never had a nosebleed in my life, so when I thought this was a nosebleed and the bleeding wouldn't stop, I was freaking out. I felt very lightheaded, and a lot of like blood clots were coming out of my nose. I had to sit on the floor of the bathroom. I had 2 boxes. I went through 2 boxes of tissues by 9 p.m. and it was still bleeding. I had a headache. My teeth hurt. I still had that toothache. I had my head over like a trash can with tissues, but I had to like take the tissue, hold it there, wait till it filled up with blood, drop it down, get a new tissue. I had blood all over my hands. Went under my fingernails, it stained my fingers, it stained my hands. It looked like a horror movie, probably. And I also noted that when I was bleeding and I had the garbage can in front of me, I was still spitting out blood and choking on the blood. And I don't know how I had my hair. I think I might have had it like in pigtails like this. But when I spit the blood out once, it went on my hair, and I swear I wanted to cut all of my hair off in that moment because it was just so disgusting, and I was like, I can't deal with hair. At 6:40 p.m., so an hour after the bleeding started, I called my doctor and left a message with like the on-call doctor because it was after hours. And she called me back and she said that this was all normal because of the vacuum, and that I should use Afrin again to stop the bleeding. So I used Afrin, I think every like half hour. I would spray it in my nose and then continue with the tissues and everything until finally it stopped at 9 p.m. After that call, it made me feel so much better because I realized this isn't a nosebleed. This is like the recovery from after I had the surgery in the first place. So I got my gauze mustache back and put that on. On day 12, this is the first day that I was able to smell again, and the reason I found out that I was able to smell is because I was wearing a native deodorant, and it was vanilla and coconut flavored, scented, and I was sitting and watching a movie and I thought I could smell it. A little later, while I was still watching the movie, Daisy came and sat next to me and she yawned and I could smell her breath. On day 14, I started seeing mucus again, and it wasn't just blood anymore, it was mucus, which also means that it's healing. She also said that I was healing very well and removed some more loose scabs, and she said the scabs were loose this time, so it shouldn't be as much bleeding as when she removed the big scab at the 1 week post-op appointment. On day 17, my toothache was finally gone. I was like continuously using the Orajel whenever my teeth hurt. The headache still stayed and continued. When I did the saline irrigation, there was no blood, and before it was like some blood would come out during the irrigation, but obviously it's the saline rinse, so it's like watered down. It would just kind of be like a red colored water. On day 19, my stitches started falling out. During the 3rd week, I only did saline 3 times a day, and the 4th week, I went down to 2 times a day for the saline irrigation. And now we get on to the point when the stents started falling out. The stents dissolve. So it's like they like break up into tiny little pieces. The stents are only like this big to begin with. It's a centimeter. I don't know if that's a centimeter. They come out of your nose when you blow your nose. For some people. For me, I mostly swallowed them all. If you're wondering what the stents feel like when they come out, these, I would feel like a pressure right there, and then it would go down. I would swallow it. The stents up here, when they started coming out, I would feel like pressure here, pressure, I don't know if you can see me, pressure here, pressure like moving down my nose until I swallowed it. Every time it came out, I like choked on it for a second, and I had to drink a lot of water to get it down. I started feeling pain from the stent breaking and falling out. Like I said, I swallowed them. I also started back at my university for the fall semester that week, and I also started back at work. A few days later, I swallowed part of my left stent, left stent here. The day after, I swallowed my right stent. And that same day at night, but like before bed, I blew my nose and some of the stent fell out. When I tell you, I like froze. I literally just looked into the tissue because the stent, it was like this big. Again, I don't know if that's a centimeter, but that's how big it looked to me. And I just kind of stared at it because I'm like, it was like covered in mucus and blood too, but I was like, what the heck is this? Yeah, because that was the only stent, that was the only time a stent came out my nose. All of the others were swallowed. So I finally got to actually see the stent. It looked like uncooked spaghetti. I thought that this stent was stuck in my throat because I could still feel it. And I drank a lot of water trying to swallow the stent, and it wouldn't go down. The following morning I called my doctor because I was concerned that the stent was still stuck in my throat, and when I went into the office, I was so freaked out at this point. Like, I was so anxious that I actually ended up having like a minor panic attack in the office. And she was still able to like clean and vacuum out my sinuses. Like I said, she's an amazing doctor, so she like helped me through that and helped calm me down. She said that since they're mostly dissolved, when they fall out, what you're feeling isn't the stent getting stuck, it's the stent scratching your throat. 2 years before this, so like in 2019, it was 2019, the postnasal drip and the congestion wouldn't go away when I had that cold after the flu. I was coughing a lot and spitting up a lot of the mucus, so much to a point that I totally tore my throat, and when I went to spit up mucus, I swear it looked like I spit up a kidney. Like, it was like a blood clot, like bloody tissue from the inside of my throat. So I totally scratched my throat, and I realized that that's what it felt like as well. And when I went in to see my doctor that day, she said that my left stent down here was completely gone, my right stent was almost gone, there was like a few pieces left, but the 2 stents up here were still intact but beginning to dissolve. And she mentioned that they're harder to dissolve because the saline helps to dissolve the stents, but they can't really reach all the way up, or the saline can't really reach all the way up here. So it takes longer for them to dissolve. I noticed that my stitches were gone on this day, and the mucus from the surgery finally stopped 3 days later. 2 weeks went by when I didn't swallow any stents, none of the stents fell out, and I thought they were all gone. But I was driving to work. There's something called like phantom pain, so I would feel like phantom stents in my nose, like I would feel like that pressure, and then I would like start to think like, oh, the stent's about to fall out, when there's no stent there actually. I still get that, and it's January now. So I kind of ignored it because it had been 2 weeks since the stent fell out. And then I just swallowed the stent, and it shocked me while I was driving, and I had to pull over and drink a whole bunch of water, and it did scratch my throat, obviously, because I was freaking out while I was driving. A few days later, I had another post-op appointment with my doctor, and she looked in my nose, said that all of the stents were gone, and that my nose was looking very open, like definitely compared to what it was before and how closed how closed my sinuses were before. My sinuses are so open now, and when she looks in, she can actually like see everything that she needs to see. And now I see my doctor every like 3 to 6 months. When I wear my glasses, I still kind of feel like not really a pain on my nose, but my nose still kind of feels a little sore from the surgery, and it kind of hurts when the glasses are pressing down on my nose. So I usually like stick like a finger underneath. I don't think I have a pair. I do. So like if I'm wearing my glasses, I'll usually stick like a finger like here so that it brings them up off my nose. The post-nasal drip and the congestion is gone. And I am so relieved for that. And if you are considering getting this surgery, or if you need this surgery, I hope this helped you and didn't scare you too much. It is a very rough recovery, but in my opinion, I think it's totally worth it. Thank you so much for watching this video, or these videos. I think I've been filming for like an hour now, so definitely gonna split this up into a few videos. But thank you so much for watching, and I will see you in 2 weeks with another, well, maybe not 2 weeks, depending on how many videos I have to upload to get all of this information out there. Bye. Whoa, by the way, whoa. Hello. Bye.